Not all skin treatments are created equal. Some are complete game changers and others are total wastes of time. I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. Patients ask me all the time how I feel about certain skincare treatments. And frankly, some of my answers are going to surprise you. In this video, I'm going to talk about 12 of the top skincare treatments that most people ask about. I'm going to rank them from 1 to 10. I'm going to give you what my explanations are and reasons behind that ranking, and ultimately help you make the best decision possible. But first, if you're new here, make sure you subscribe to this channel where we upload a brand new video talking about skin wellness and skin health and facial rejuvenation every single week. We did this on Instagram not too long ago, and we got tons and tons of interest with a lot of people asking for us to do a YouTube video with greater and in-depth explanation. So here it is. Number 1, retinol. Retinol is by far my favorite anti-aging skincare ingredient. It's a vitamin A derivative. It stimulates collagen, it enhances cell turnover, it decreases pigmentation. It's a multitasking powerhouse and should be included in nearly every anti-aging skincare routine. It's also one of the most studied and researched actives on the market. As you can tell, I love retinol and I give it a 10 out of 10. Why I love it so much is simply because it works. And when you think about increasing collagen stimulation while the rest of the cells are turning down their production of collagen, you are literally reversing skin aging and in improving the fine lines and wrinkles that come from thinning skin over time. And what more can anyone ask for when it comes to anti-aging skincare? The downside to note, however, is for a lot of people, retinol can be a little bit harsh and it could have a downtime associated with getting acclimated. There's a purging phase, there's a phase where the skin has to get over the initial irritation as the cell turnover starts happening. So for a lot of people, conventional retinol treatments or even the prescription retin-As can be very difficult. And as a result, people either tone down on it or don't use it consistently to get the best benefits from it. So if you've tried retinol in the past or you're a little bit weary of doing it because you've heard it can be harsh on you, there are techniques that you can do to help improve it, combining it with a moisturizer, slowly edging into it. And if for those of you who just want to make it super easy, try the Karam MD Trifecta. It uses a different type of retinol configuration completely. It's a microdose technique which slowly releases into the skin. Really good for sensitive skin. People who have had histories of challenges with retinol, this can be an absolute easy way to use retinol without all that irritation that comes with it. Check it out or learn more about it on KaramMDSkin.com. Overall, holy grail, must have, highly recommend. Next up, sunscreen. Sunscreen is by far the most important way to protect your skin from aging and sun damage, and an absolute must-have as part of any skincare regimen. Natural rating, 10 out of 10. Why I love it? Well, if it decreases the amount of collagen loss and protects your skin from losing more collagen and thinning and fine lines and wrinkles, it also decreases the risk of pigmentation, sunspots, discoloration, both browns and red pigment. And really importantly, it decreases your risk of having skin cancers, melanomas, basal cells, and squamous cells. All of them are going to be enhanced with a good broad spectrum sunscreen. Absolutely essential year-round component of any proper skincare routine. The only downside is, unfortunately, most people don't use it correctly. They don't reapply if they're out in the sun all day long. They sweat through it, etc. So make sure you are following best practices when it comes to using sunscreen so you get the most out of it and protect your skin as much as possible. Overall, non-negotiable must-have in a skincare routine. Let's talk about Sculptra. Sculptra is an injectable treatment that, when injected, stimulates collagen, increases volume over time. Now, there's two different ways Sculptra can be used. Some use it as a volume augmenter, which is what it was originally designed to do, and it was FDA cleared to do. And by stimulating the collagen in the deeper tissues, you begin to see volume increasing. Now, in that way, I give it a 5 out of 6. It's a, generally speaking, good treatment for volume augmentation, similar in the general range that I would give almost any other type of filler. It's a good choice. Where fat transfer might be the best choice, this is a good choice. Specifically for areas like the temples or in the mid parts of the cheeks, or even this part of the cheek. Anywhere near the mouth, around the eyes is a no-fly zone, and as a result can be very, very dangerous because you could get little beads, etc. Now, when you use it in areas like this and along these areas, it makes surgery more difficult, so I'm not super bullish on using it in those areas because the scar tissue that forms between that layer can be harder to dissect for surgery. There's a different way to use Sculptra, which I'm not quite very keen on, and that is the use of it when you're trying to improve collagen production in the skin, which forces the injector to inject it very close to the skin. Now that gets into a lot of trouble when it comes down for surgery because dissecting through those areas of scarring makes it very challenging. Not to mention the fact that if you're trying to improve collagen in certain parts of the face, but you have to avoid areas like the forehead because it can be lumpy bumpy, the areas around the eye, the areas around the mouth, well then only part of your skin is seeing the collagen stimulation that comes from collagen, and you're also getting potentially unwanted volume that's building on itself. So you're gonna get this disproportionate look. Given the expertise that it requires, given the potential unpredictability, the limitations on areas, that's where my general mixed feelings about it lies. So as a treatment for skin collagen stimulation, in my mind, it's a 0 out of 10. On to the crowd favorite, Botox. Botox is a brand name for a class of injections called neuromodulators. There's a number of them. There's Xeomin, there's Dysport, there's Daxi. All of these work by decreasing the transmission of neurotransmitter at the neuromuscular junction. What that means is that you can't express a muscle when it's used. So that comes in very handy when you're trying to decrease expression lines in between your eyes. Those are termed the 11s, as well as the frontalis muscle. And if it's used every 3 to 4 months, which is roughly about how long it lasts, you're going to get a preservation and a smoothness in that area and prevent that skin from deepening and forming those deep static lines that we all have a hard time managing and treating once they've formed. Botox, I give a 9 out of 10. As mentioned, it's great for prevention as well as the fact that it's effective. And it's been around for a very, very long time. I think it's 40, 50 years at this point. So lots and lots of studies, lots and lots of information about safety. I use it, my wife uses it, I'm comfortable with it. The only downside is the fact that it's temporary. It lasts 3 or 4 months and you have to redo it. Overall, however, it's an excellent tool when used correctly for the right indications. All right, let's talk supplements. Oral collagen. Oral collagen is a very popular supplement in the hydrolyzed form, in the peptides that it's usually sold as. It is used to enhance skin health, fine lines and wrinkles, nail growth, hair growth, etc. And it even has some potential benefit on joints. My overall rating is a 4 out of 10, and here's why. The research is very limited. It's small studies, very difficult because it's hard to create a proper control group, a blinded study group, etc. But the evidence does show that there's some mild improvement in fine lines and wrinkles. It's not clear if it's because of hydration or if it's because of the way it's working. There is no logical way physiologically to understand how ingestion of a collagen peptide would directly impact skin. That's where the challenges in terms of connecting the dots, but there are some evidence, anecdotally, empirically, even some research studies that show that there is some effect. That's why I'm giving it a 4 out of 10. Overall, not harmful, but don't expect miracles and definitely don't lean on it as being your foundation of anti-aging. Plus, if you are going to use it, make sure you're using vitamin C at the same time because collagen production requires vitamin C in addition to amino acids, so that's key. Now let's look at microneedling. And here we're talking specifically about cold microneedling, meaning literally without any energy associated with it. In this form, it uses tiny little needles that penetrate the skin into the dermis, and that stimulates collagen through basically an injury response that the skin recognizes and then starts to deploy and produce more collagen in response to. This can thicken the skin, it can decrease fine lines and wrinkles, and more importantly, it resists the natural degradation of collagen that the skin undergoes with time. My rating, 7 out of 10 when used in this format, especially for skin that's thin like the neck skin, etc. But overall, I like it for texture, fine lines and wrinkles, and I also even like it for acne scarring and even post-surgical scars that can have an impact by getting that cell turnover and collagen production going. The downside is, like many other treatments, it requires continual use. It requires multiple treatments. Oftentimes you would want to start with a package of 3 to 5 and then carry that process on every 6 to 12 weeks to get the benefits to keep building. Now, consistency and continuity is a common theme, and it totally applies to just about every type of effective skincare treatment. But overall, if you're doing it consistently and you're not over expecting, you're gonna be happy with it, and I give it a solid rating, and I think it's an important part of a good skincare routine. Similar but more intense is RF microneedling. In this case, microneedling is being combined with radiofrequency energy, which heats the skin, stimulates more collagen production, and ultimately gives a bigger and better potential result. People use it in different ways. In our practice, we only use it in the skin, which means we keep it shallow, 1 to 2 millimeters max depth penetration. Other people are using it for tightening their face. They're trying to use it as a replacement for surgery. In that case, the energy is being deployed between 4 to 6 millimeters, and that's where precious facial fat lives, and it overlies the facial fascia, which is what's supposed to tighten if you do this. Now, I'm gonna give it 2 different ratings depending on how it's used. When you're using it superficially or shallow, you're doing it to improve skin quality. I give it a 6 to 7 out of 10. It's a great treatment. Get about 30% more collagen production when you introduce the RF into it, heat. We have it in our practice, we like it. Now, when you use it for deep penetration and tightening in replacement of surgery with those expectations and notions, I give it a 0 out of 10. And this is the category of things like Morpheus 8 and other treatments that are penetrating into that deeper level. And why I don't like it there is because along the way, you're invariably potentially damaging that precious subcutaneous fat, which is important for keeping the skin supple and youthful looking. And additionally, it can make surgery more difficult, and the upside, the gain from that procedure is very limited. So the changes that you see are not that impressive, and you do take a risk, and ultimately usually leads to disappointment. Overall, decent for skin texture, skip it for tightening. On to chemical peels. Chemical peels are a treatment that are used to basically exfoliate and remove a significant portion of the top layers of the skin. So it basically takes the epidermis down to the level of the dermis, depending on the depth of peel that's used, and it literally removes it. So what comes in place is a fresh, bright, new layer of skin, which can have less wrinkles, less discoloration, more glow. This is one of those treatments that's been around for a very, very long time, tried and true. I give it a 7 out of 10. Why I like them? Because you get what you expect. Depending on the depth of penetration of the peel that you can get a very expectant result. In addition, improving fine lines and wrinkles, discoloration, and texture are things that people really love to see in their own skin. The downside is that it does require a downtime. Now, depending on how deep you go, the downtime can go anywhere from a few days to 2 weeks to even 4 weeks. Make sure you have this conversation with whoever's gonna do your peel so you choose smartly and you make sure you plan for it, because last thing you wanna do after your chemical peel is get exposed to too much sun. So depending on the depth, you're also gonna manage what time of the year you get this done, as well as how much downtime you should really set aside when it comes to normal activities. Overall, great treatment for your skin, especially if it's planned carefully and generally done outside of summer months. Next up, red light masks. So red light masks are at-home devices that are basically designed to potentially stimulate collagen, decrease inflammation, and overall make skin healthier. There's a huge variation of red light devices that are out there, that have different types of intensity, different types of light spectrums that are being used. In general, my rating is a 3 out of 10. Why I'm not convinced? Well, number one, the evidence is very soft. It really isn't that significant of a stimulator of collagen compared to the things that we already know that work so well, things like retinol, microneedling, chemical peels, etc. So as a result of that, not a great choice. In fact, underwhelming in my opinion. To me, it feels like another one of those things that it's more trendy, some science behind it, but less effective than it's worth. Let's talk about Gua Sha. I don't know why I always love saying that. Gua Sha is a facial massage technique using a stone or some type of device that technically is supposed to detox the skin and then sculpt the skin and give the face a more youthful look. My rating is a 2 out of 10. Why? Because I feel it's overhyped. First of all, any change that you see is temporary. And even if you do get a lifted effect, certainly it's not going to last. It's going to fade away very quick. And it's definitely not doing anything to truly stimulate collagen production through that injury cascade that we talked about. And anything, in my opinion, that's not stimulating collagen or improving collagen is something that's probably just taking up time out of your day that it's not necessarily worth its time. Overall, maybe it's fun from a self-care point of view, but I wouldn't consider it a serious treatment, and I don't think you should either. A surprising entry, UPF clothing. UPF clothing is sun protective clothing designed to block UVA and UVB light from hitting your skin. I give it an 8 to 9 out of 10. Here's why. If you're gonna be out in the sun on a regular basis, your neck, your décolleté, your arms, your chest, your legs, etc., all are getting beat up by sun. It has the same effect that it has on your face. On a regular basis, protective clothing can really reduce the amount of sun damage, decrease the chance of skin cancers and discolorations and all these other things. These are things that my wife has been doing literally since her probably 20s and 30s. Her skin looks like it's like 20-year-old skin. It hasn't seen that much sun. So the downside is that it certainly isn't fashionable. And number two, it doesn't replace sunscreen. You're gonna wanna use both. But overall, a very smart part of your skincare and anti-aging arsenal, in my opinion. Last but not least, HydraFacials. HydraFacials are a treatment done by your esthetician, which I personally like because it deeply cleanses the skin by using a vacuum first. Then it adds a subtle exfoliating chemical peel, overall improving the skin from point of view of cleanliness as well as texture, and get some stimulation of collagen, most likely from that very mild chemical peel that you use. And then the final step is that it hydrates the skin with serum, etc., to basically give that skin a nice boost. There's essentially no downtime with it and no risk. And it's great for maintenance as well as right before any type of an event. Your skin gets that hydrated, pretty glow, and off you go. My overall rating is a 7 out of 10. But like other skincare treatments, you see a common theme coming up here is it needs to be done regularly. So typically once every 4 weeks or so is the right interval. Overall, I would say it's a nice luxury treatment. It's a little bit on the expensive side relative to maybe even a standard facial. But at the end, it does give some results, even though they're not dramatic. So don't expect too much, but they are actual results. And for years, my wife was doing HydraFacials. I think she's a great example because at 53, her skin looks better than it did when she was in her 20s. But here are the things that we just mentioned that she does. So number one, retinol. She's been on retinol since her early 20s, mid 20s probably realistically. And now she's on the trifecta, which includes the retinol. Sunscreen, avid sunscreen user. Skin looks amazing. She's also very big on the sun protective clothing. She's been using oral collagen in part of her, she makes a little green tea collagen mix. For her point of view, it's a little extra protein. Maybe there's some benefit from it, but she actually enjoys it. She's been doing microneedling specifically on her neck, probably for the last 10 years or so. Oh, and Botox. She has been doing Botox from the beginning as well. So honestly, when I advocate for things and I advise her to do things, it's from the same point of view that I'm advising you guys on. So in the end, there you have it. 12 of the most common skincare treatments, my opinions on it from a facial plastic surgeon's point of view. There are some wonderful things out there that can improve your skin and keep you getting younger and not older. And there's also a lot of things that are just a lot of hype and a lot of misdirection involved in them as well. And I'm here to help you navigate through all that. And if you want to go a little bit deeper than what I even cover in these videos, make sure you subscribe to the Karam MD Journal. That's a newsletter that comes to your email every single week. In the journal, we break down ingredients as well as talk about myths and just overall how to use best practices in getting the most out of skincare. And finally, listen, if you have tried some of these things and have a different experience and a different opinion than mine, by all means, please share them. This is a community. Everyone else should benefit from it. I'm not trying to, shove this information down your throats and say, this is how you should do it. I'm simply giving you my my professional opinion and my experience with patients over the years. But if you had a different experience, please share them. I think it'll make for great conversation and great reading in the comment section. Also, if you like this format and enjoyed the ranking and the reasons behind it, etc., and want to see more, drop any procedure or treatment or anything you've heard about that you would like my opinion on. We'll make another video like this. It'll be great. Until next time, my friends, Dr. Amir Karam.